Hi, I'm Tahlia Ruschioni, the Executive Director of the Bateman Horne Center. On this episode of the Eleanor Stein podcast, I will share all of the various resources you can find at the Bateman Horne Center and highlight some of my favorites.
Welcome to the Dr. Eleanor Stein podcast. In this show, you will hear expert medical professionals, researchers, and people with lived experience share science-based, low to no cost strategies to help people with complex chronic diseases. Listen in for another dose of education, empowerment, and hope. Hi, everybody. I'm Dr. Ellie Stein. Welcome to the Dr. Eleanor Stein podcast. I am thrilled today to welcome our special guest, Tahlia Ruschioni. She is the Executive Director of the Bateman Horne Center. She's going to share with us how Bateman Horne Center and allies, because there are many of them, are setting the standard of care for medical education and training. Now, we're going to talk about we all talk about how important education is. I've talked about it, I've given talks on it, I've written about it, how desperately we need more ME literate professionals. We need more research, we need more public awareness, we need decreased stigma. And the Bateman Horne Center, in collaboration with researchers, clinicians, and educators around the world, is leading the way, developing a wide range of educational programs and resources. So listen up, because you're going to get the inside scoop on what those resources are and how to find them. My relationship with the Bateman Horne Center goes way back. I've been in contact with Lucinda Bateman, the founder of the center, for over 20 years. And in 2012, I actually made a pilgrimage to Salt Lake City. Unlike most, I wasn't going to see the Mormon Tabernacle. I was going to the Bateman Horne Center. I spent, I think it was 3 or 4 days at the clinic. They generously allowed me to sit in, meet the team, and get a sense of how they were providing care. At the time, they were in the middle of changing their model of care and their model of funding. And looking back, I can see that they made some really good decisions because they seemed to be thriving. Talia joined the team in 2011, and since then, 2019, my mistake. And since then, they've gone from strength to strength. They've been involved in some really key educational contributions, including the US MECFS Clinicians Coalition website, the influential paper in Mayo Clinic Proceedings called MECFS Essentials of Diagnosis and Management, and most recently, what I consider a tour de force, the Clinical Care Guide, Managing MECFS, Long COVID, and Infection-Associated Chronic Conditions. We're going to talk, I'm sure, more about all of those. So Tahlia Ruschioni is a healthcare leader with over 20 years experience in various fields, including trauma care, rehabilitation, public health, and medical education. At the University of Utah Health, she led clinician education and outreach across a seven-state hospital network, developing accredited CME programs, Project Echo series, and value-based learning initiatives. Since joining Bateman Horne, as I mentioned in 2019, Talia has spearheaded the growth of the Medical Education Resource Center and has reached more than 17,000 clinicians across 90 countries with accredited training in MECFS, long COVID, and related conditions. She has built collaborations with organizations such as the National Institute of Health Recover Initiative, the Centers for Disease Control, and many international partners. Through this work, Talia is advancing Bateman Horne Centers and really all of our mission to expand access to informed care, raise standards of care, strengthen health infrastructure, and improve outcomes for patients. Like I said, we all benefit from Talia's work and the Bateman Horne Center. So, Talia, welcome to the podcast.
Thank you, Dr. Stein. I feel so honored to be here.
You can call me Ellie.
Okay.
So you've worked in many areas over your 20-year career, and I'm curious what drew you into MECFS?
Oh, that's a good question. So, um, I have worked in a variety of healthcare settings. When I worked at our level one trauma center here, I worked everything from the ER, ICU, all the way up through oncology and trauma. And what I learned in that journey is that patient care is unique to each individual. And there
Hmm.
are some things that are really hard to um, diagnose. And when medicine doesn't quite know what to do with that, it then becomes the onus and problem of the patient, right? And
Right.
so I've seen that play out in a lot of marginalized diseases, but it wasn't until I met Dr. Lucinda Bateman when I was working at the University of Utah. I had taken over the pregnancy care echo program, and by happen chance or fate, I don't know, that very day, Dr. Bateman came and lectured on MECFS. And I realized for the first time that what we've been trying to figure out for my sister's journey and also my father, that this disease was almost identical and matched every single symptom that they had. And medicine had been failing us for, I don't know, over a decade trying to figure that out. So I connected with Dr. Bateman and I asked her if she would teach me more about this so that I could learn and bring that back to my family in Colorado. And as our programs progressed throughout the University of Utah, the very next year I was creating a complex care series. And I thought, what better disease to break down than ME/CFS? And to bring more awareness about this, but also to offer the platform and opportunity to reach more providers
Hmm.
specific to this education. So I did that, and I reached out to Bateman Horne Center, and eventually they asked if I wanted to start doing this medical education with them, and I handed over my resume. So I've learned through both professional exposure, but then also my personal experience being a caregiver for my sister and my father at times growing up, that this disease, um, it is invisible to the normal everyday public, and that marginalization happens regardless of your economic status when someone doesn't understand what you're going through. And so when I joined the Bateman Horne Center doing medical education, it became kind of a personal mission that
Yeah.
others don't have this same experience.
So did I hear you correctly that your sister and your father had been affected for more than 10 years and didn't have a diagnosis?
Yes, my dad
That's
growing,
really striking.
oh yeah, I mean it's horrible, really. My dad growing up was very, very sick, and now looking back, knowing what I know, I'm like, oh, it's because of connective tissue disease, and it's because of
Mhm.
PEM and dysautonomia and all the things, and so he had been kind of pocketed into the autoimmune condition world, right, and treated with, I would say, a lot of biologics that made other pieces of his illness worse because it's been ME/CFS the whole time.
Right.
And so that's been hard to watch. But even not to take away from him, but I think it's harder when you watch someone young learn and I guess I shouldn't say learn, but fight the medical system constantly trying to find an answer because you so quickly start feeling like I'm crazy. This is in my
Right.
head, and my sister did have a lot of psych referrals, and they would say, "We don't really know. It just seems like anxiety." Well, sure enough, once we got her diagnosed and started to stabilize her illness and dysautonomia, mast cell, all the things, all of that went away, right? There is a secondary grieving to having this illness, but that primary disorder, of course, was never really there.
Wow. So the benefit of you, I mean, we're all benefiting from you being at Bateman Horne. We're benefiting through all the work you're doing, but you're also benefiting, like your family's directly benefiting from everything you're learning.
Absolutely. I say this to Dr. Yeoman every day that I don't think my sister would be here if we hadn't met him when we did and joined Bateman Horne Center. And so we are very
Wow.
privileged and blessed to have access to that information, which is why it feels even more like my personal mission to make sure more people get this same access and level of care.
So that's kind of leading into my next question is from those personal experiences, what would you like to see? What would be your kind of dream scenario in terms of medical education?
Oh, well, do we have enough time for that? Uh, I,
And then we'll go into what you've already done and are
sure,
working on. Yeah.
sure. My dream would be, you know, I'm humbled every day to be able to work with some of the best in the whole world, both on, the scale of Salt Lake City with Bateman Horne Center and the amazing clinicians that we have and researchers, but because of also all of the people that I get to work with in this field, colleagues like you and everybody else that continues to just morph and teach me and others in this field, those who bring that patient advocacy and patient experience, they
Yeah.
teach us every day, right? Our patients are our greatest teachers.
Yeah.
And so I would love to be able to see the growth of Bateman Horne Center become um, a little bit more scaled by way of being able to see more patients, bring more
Mm,
patients through to get a diagnosis, to get a care plan, and to be able to help do some training and coaching with their primary care or even specialty care providers back home. That's how we start to bridge and branch this network. CME, continuing medical education, is so important to what we do because that's how providers um, receive the information every year, right? But it's also part
yeah.
of their credentialing and all of the other things. So,
Mm,
without it being forced, it would be nice to have a center expanded in a way that allows fellowships to come through,
mm.
residents to come through, practicing clinicians because again, it's that person going back into their community and making more touch points. That's how we start to scale this. That would be my dream.
So I'm kind of hearing like a vision for a center of excellence where you could really ramp up clinical care and then use those patient encounters to educate all of the providers that they're associated with.
Right. And to bring more providers through that training kind of model
Yeah,
so that they can go replicate back in their community. It's also beautiful because then it can feed research, right? It
right.
allows us to do more clinical trials, to biobank, to stratify patient populations. I mean, it kind of feeds the cogwheels that we already have existing. So we're working towards a model like that we hope to launch in 2026. But
Wow.
more specifically, I think that it's going to allow us to scale education and training in outside of just a didactic setting.
Wow, that sounds really good. And I'll maybe ask you more about that at the end. Um, I'm wondering a little bit about kind of comparing your experience before you came to Bateman Horne. You were working in different areas of health and in the education area. Are there differences that you're encountering when you were putting out programming or resources on those other topics compared to the resources that you're putting out on ME?
Um, can you define that a little bit more?
Like, do you have to, the attitudes out there in society are different. Like if you
Oh,
were putting
yeah.
out resources on cancer, it's straightforward. You've got the avenues available to you and people are open to it and there's not that much stigma. So I'm just wondering if you have to do things differently because of the topic.
Yes.
Okay.
Oh, yes. I hate saying it like this, but the reality is, and we know this all too well if you live and breathe this disease, that without diagnostics and a biomarker,
Right.
you're constantly trying to prove that this is real. And so we have um I think that what makes BHC's education successful is that we have been able to pivot based on that, not digging in and not trying to throw it in their face, but help providers of all specialties see that they are seeing this. And by doing that, that may mean that we don't call it MECFS right off the front, but we
Mm,
start talking about dysautonomia, mast cell activation, sympathetic overdrive, fibromyalgia, and then you start saying long COVID, and then you help tie them into well, this is the diagnostic criteria for ME/CFS, so therefore these patients are meeting this, and this is the driver behind these things, right? So it's been a little bit of a reframing, helping to, I guess, for lack of a better phrase, lead them to the water. And
Right.
by doing that, I have seen so many um, providers and conferences on CMEs in person talking to them. They start to think in their mind and catalog, oh no, I missed it with this person. Oh, it
Right.
is this person. And that's that moment, that synapse that is so beautiful and critical. And you can only do that by helping empower providers, not trying to tell them that they've been doing it wrong or seeing it wrong this whole time.
Right. So there's some real skill, like education skills involved in presenting it in such a way that it won't be maybe challenging their existing beliefs, but hopefully building on it, something like
Right.
that.
Yep. And I
Yeah,
think
well
that's
done.
also the beauty of case-based learning, right?
Mhm.
And in some of our internal provider forums, but also Echo. Project Echo is so successful because it uses a case-based learning. Cases are how we see it, right? Because that's how the providers interact with their patients every single day. So by reaching them how and where they learn, we're helping to naturally unveil that this is, a part of their clinic caseload.
Can you just explain? I'm also a little bit fuzzy, but probably some people listening don't know what a Project Echo is.
Sure. So Project Echo was founded by Sanjeev Arora, and it has been largely out of the University of New Mexico, but there's a whole history behind Project Echo and how it got started. Just to not go into a history
Mm.
lesson here, but just the idea behind what Echo is, it is a hub and spoke model. So you
Okay.
have a hub like, say, Bateman Horne Center, and then through that platform, you're able to reach other spokes, so hospitals and clinics throughout not just the United States, but the US or the entire world. And it brings in the learning, so you're kind of creating this network. It also is and was originally formed to be able to offer case recommendations from a specialist to a primary care without necessarily having to have that patient see that specialist. So that primary care doctor or even another subspecialty can carry out those recommendations. So it's a
Okay.
network of knowledge. Yeah, it's a
And
beautiful
case-based, I
platform.
mean, I've heard recently people saying doctors, we all work on pattern recognition, right? And so by presenting cases, you're kind of presenting patterns that, like you say, the doctor or nurse or OT or
Yes,
PT or nutritionist or I don't know, social worker, psychologist, like all those professions might go, oh, I see that, I recognize that.
yes, exactly. It brings it to life. Yeah.
Yeah,
It humanizes what is otherwise just an ICD-10 code, right?
right, which is boring and hard to remember.
Right.
Yeah, I can attest to that. So I'm going to kind of divide what we talk about by recipient category. So first, patients. What have you worked on with Bateman Horne and what are the resources available, I guess, mostly through the website for patients?
Sure. So, I try to really think about and in talking with working with a lot of patient partners and lived experience professionals, understand what are the things if you're trying to live with this illness. What is it that you need to know first and foremost? One, so that it validates what you're going through, and two, that can help inform you in a way that allows you to live with this illness and not be fighting with the illness itself, right?
Mhm.
It's that push crash. Um, and it's so hard to try to figure out that balance. And so a lot of our patient resources are around just that. We created a crash survival guidebook. So what we call a post-exertional malaise crash or event, and how to both survive and navigate through that journey, but then also be able to give a resource to caregivers and healthcare professionals to help you through that journey.
Mhm.
As we know, when patients are in a crash, it can be really hard to communicate your needs, and yet you have very basic survival needs that still must be met. So trying to equip patients and caregivers and their loved ones with those tools was really important for us.
And where would I'll ask you this probably repeatedly, but
Okay.
where, so I've read the survival guide. It's a really quite detailed, but very easy to read, like very accessible. And where would someone find that?
So I think the easiest way to find it is on our BatemanHorneCenter.org website.
Okay.
And then if you go down to the top resources page, almost
Okay.
everything I'll list is on that top resources page,
Okay.
um, because those are just that, our top resources.
Okay. And so what else is there for patients, maybe focusing on that? I just found that the other day. I went, oh my gosh, this is a gold mine.
It can be almost overwhelming sometimes how much information there is, but we also have a basics video series. So these videos are 5 minutes or less, and they've broken down key aspects of the diagnostic criteria. So post-exertional
Okay.
malaise, the diagnostic criteria itself, orthostatic intolerance, and some other things along those lines.
Hmm.
I think those are gold because it is one of our doctorate of physical therapy partners, Clayton Powers. He has helped create those in a way that's both translational for patients, but also a provider or caregiver to understand what that person's going through. Our 10-minute passive standing test, we also have called that historically the Nasaline test. It's accessible. It's a quick in-office diagnostic tool that providers can use when tilt table testing isn't as accessible or financially available for many, to help identify if an orthostatic intolerance is there. I think just that alone can be really revealing. We also have some handouts on ER considerations. There's nothing
Mm-hmm.
worse than having to go to the emergency room while you're either in a crash or dealing with some other event, acute or otherwise, and the staff not knowing how to even manage aspects of your illness, and it then exacerbates it, or you don't
Yeah.
have words, right? So that's one of my favorite tools that we've developed. And then we have a couple of other things that are more directed towards healthcare providers.
Okay, that's great. Um, and on your YouTube channel, you've got like I hadn't looked at it for a while and it's really expanded. I'm just going to share some of my favorites.
Okay.
Um, so there's an animated video narrated by Maito, who is a little, I guess, like
That was one of my
Talia-like figure.
favorites. Yes.
Yeah. And I think it's about 5 minutes and it talks about energy and making the metaphor, I guess you would say, of energy like a cell phone battery. So it's so clear everyone can relate. And you know how if your battery's getting low, you've got to charge it. And yeah, I won't go through the whole thing, but it's really, I think, very accessible. You've got a whole series of videos on post-exertional malaise, which are really clear and explain what it is and how to manage it. There's a great 5 minute summary, and maybe I'm dating myself because it's probably several years old, called What is MECFS? And I got permission many years ago. So that's on my webpage. I have a link to it because I just find, again, people, it really helps people. I recommend them to share it with people who they're wanting to understand their condition. So family and friends. You've got a whole series of videos on mindfulness, on yoga and modified exercise, on living with chronic illness, on OT and PT related topics. And I was really blown away. I mean, you could be watching that channel probably for months.
You could. I
Yeah,
I want to mention because or speak to the modified exercise and yoga.
sure.
Um I want to be clear. That's not everyday regular yoga. It is not prescriptive or graded in any way, shape, or form. This was actually made by someone with the illness itself. And the idea is that you work within your limits. It's very, very modified movement. We don't even like to use the word exercise because it's movement. And I think that that's something that people will find a thread through all of our education, especially that with our PTs and OTs. We're trying to make sure that function trumps any sort of exercise, right? Because in essence, everything we do from breathing requires energy. And in a body where that is limited and of complete value, we have to really be mindful of how we use the energy itself. So we like to call it movement rather than exercise.
Yeah. And would all those videos be created by people who are Bateman Horne Center affiliates, or kind of who's the mastermind behind all of those programs?
Me.
Okay.
Uh, the mastermind, yes. I should say orchestrator, yes.
Yeah.
Now, those who have helped develop the content itself, I have to defer to them, right?
Right.
So, the PT and OT, speech therapy, all of our allied professional resources, I have an amazing network of lived experience professionals, those practicing and serving patients in this population, caregivers, the whole gamut, who have all supported the development and or creation directly of this material. And I could not do it without them. I would call them all my friends at this point, and also my family because we all learn through this disease together. So everything that we have out there is driven by someone who has direct contact and experience with this illness.
Okay. Oh, I just had a question and it flew out of my mind. Hopefully it's going to come back, but I'll keep moving on. Um, oh, right. Do you have anything on your YouTube channel or your top resources page for the family members, the carers?
Yes,
Yeah.
I'm glad you asked that. So yes, we do have on our website a whole section for the caregiver or care supports because that's a huge
Yeah.
piece of living with this illness and I am someone now who lives with ME/CFS as well, post-COVID ME/CFS, but I've largely been in the caregiver role. Um, you need that support as a caregiver, and you need to be able to have those tools to help support that person because there's nothing worse than feeling like you don't know what to do, right? And there are going to be days that you don't, and you're not getting it right, but at least having access to some of our caregiver supports to either help the patient communicate their needs with communication cards, being able to we have a couple of resources there that are expressing the experience from the point of the patient. Again, sometimes it's hard to put into words what that's like.
And so
Also,
to help the caregivers have a better understanding of what
exactly.
the lived person is going through.
Exactly.
Yeah.
Um, and then recently we've connected with a really, really wonderful person in the community, Kim Moy, who has a caregiver support group. And I think that that's
Oh,
so vital, right? It's not to say that patients are burdens, our loved ones are burdens at all. It's that we're navigating this together, right? And every
yeah.
person is impacted by chronic illness.
Great. Thank you. I'm going to move on to professional education and maybe I know this is pretty vast, so if you can kind of share what are some of the efforts that you've got going there? And I guess if any professionals happen to be listening, how could they access them?
Yes. So, the Project Echo program that we run with the University of Utah, we've been doing that for a few years now. It's a great monthly platform where providers can join and receive free CME, but then also connect in with others in their field. It's multidisciplinary. We reach folks from all over the world actually with our program, and it will have a short didactic at the beginning, and then we use the rest of the time to talk about either that or cases or whatnot. So I would encourage anybody who's a professional to join us for those. If you're not able to, we do have an entire page, a repository on our website. It's under medical education and then continuing medical education. Within that, we also have other echoes that we do a lot of work with, but that are also just independent from Bateman Horne that have a wealth of like-minded education that I would encourage folks to explore. Um, we do have some continuing or enduring medical education that people can take if they're looking to get CME on post-exertional malaise. We have one that was from a ground rounds on long COVID and ME/CFS. And our probably most important release recently was this clinical care guide. And the idea behind the clinical care guide is that it has taken, at least in my time with Bateman Horne Center, the last 6 years worth of um, institutional knowledge from the providers and those within our network of allied professionals and trying to channel it into a bit of a roadmap or a guidebook that can help professionals know where to start and where to go and how to prescribe and how to manage these patients. It's our first edition. We have a lot of
Yep.
things that we're already thinking, oh, we should have included this or that. But it is something that patients and providers can pick up and be able to better understand how to manage this complex disease.
Can you maybe just share a little bit about what someone would find in the guide?
Yeah, so we break down the diagnostic criteria of ME/CFS largely, and then we also go into the most common comorbid conditions
Mhm.
associated. So everything from chapters on post-exertional malaise, dysautonomia and orthostatic intolerance, small fiber neuropathy and pain. We have a whole chapter for caregivers and how the providers can help the caregivers and work as a team. We also try to address pediatric care and severe and very severe because it is one of the most unrecognized and untouched populations that are out there, and we need more people to know how to help. So.
Yeah, that's actually a question I had is what resources do you have specifically for the severely ill?
So for the severely ill, we're working to expand more of that. We did a really wonderful webinar series with Solve ME/CFS last year. Yeah, last year. And within that, we broke down different aspects and components of severe care and supports. So I would encourage folks to take a look at that series. We've had everything from disability and accommodations and supports to medical approach, um, supporting the caregiver, and then advances in the research field. So that's
Okay.
included in there as well.
And I guess that's something maybe to point out, um, which I think is a strength, is everything I've ever seen on your website, it's very clinically focused. Like you're involved in research, but most of the offerings on the website, they're research and evidence informed, but they're very practical things that people can like learn and go, "Oh, okay, I'm going to try that, or I'm going to ask my doctor about that."
I would agree with that. I think that the beauty behind how Dr. Bateman created this Center of Excellence is that we do have a very strong research pillar to the organization. So it's not just clinical care and education and outreach, but we have a pretty strong research pillar that um, validates what we're seeing and doing in the
Right.
clinic and vice versa. It feeds the research, right? So I would call it just that, evidence informed.
Okay. Do you have a sense of how many healthcare professionals you've reached through the all these various means?
Oh, um, I mean, oh, I was just trying to think. I should have looked this up before we did this. And calculated at least the last 6 years. I'll say this. So we partnered with the Open Medicine Foundation 3, 4 years ago now to create the Medical Education Resource Center, or MERC. And that partnership allowed us to expand both our access, but then our ability to create these very centralized and important focused resources. In the last 3 years, we've reached over 17,000 professionals just by way of teaching and didactic. So that doesn't include views and downloads and all of that stuff, just live didactics or
Wow,
training.
that's impressive.
in 89 countries and 48 states, so US states. And so um, I think you could probably scale that even more because I've really just, that's the number that's in my head because I just ran a
Mhm.
report on that. So
Yeah,
I would say several thousand. Yeah.
that's fantastic. And do you have a sense, and this is more not research based, but I worked as a physician in this field in Calgary for about 25 years, and I felt like my efforts weren't in vain because, when I moved here and opened my practice, I wasn't getting any referrals. Nobody had heard about it. Nobody wanted to use the words ME on the referral. They would say, "Oh, this person's really tired. Could you please see them?" And so I would send the referrals back and say, "Oh, I only work with people who have ME. Do they meet criteria?" And then we'd send them a copy of the criteria. So I would force them to at least read it
Smart.
if they wanted to access
Yeah.
the service. And, did a little bit of teaching at the university and a few CMEs and things like that. And I feel like by the time I retired, most of the family docs I came into contact with were more open. Like I felt like some small progress was made. You're scaling it, so many times bigger than what I was able to do just locally in Calgary. I don't know if there's any way to measure, is it having an impact?
Yeah. You bring up a really interesting question. And I would say that there are numbers on you know, people reached by way of conferences and grand rounds and all of those things, continuing medical education. But where you really start to realize the impact is that practice change and the
Yeah.
implementation beyond it, right? Because you can hear something, how you go and change the way that you do it is a totally different discussion, right? So, or measurement, I should say. So we have tried through as many of the continuing medical education outlets that we can um, add as part of claiming the CME some sort of questionnaire around both understanding if their competency changed, their understanding of the illness pre and post. That's my favorite one to look at. But then also how it's a very direct question on how they're going to go do this differently back in their practices. And
Yeah.
I'll see everything from I'm going to ask better questions to understand if post-exertional malaise is there. I didn't even know that was a thing. To, I'm going to start using the passive stand because it's really
Yeah.
accessible for me. So it's rewarding to see those answers because that's how we'll know if they really heard what was being taught, right? And then the other piece of that are obviously the in-person trainings. So we've had quite a few residents come through, a lot of different practicing clinicians, and being able to even assess them pre and post,
Mhm.
and ask them afterwards, how will you do this differently? And how are you going to then help us scale, right? So bringing the education back into their community. I think that's how we can really start to gauge if this is being, if the tide is changing.
Yeah, that's fantastic. But I guess the last area I wanted to ask you about is some of the amazing collaborations you've fostered. And I don't know if you can share some of the organizations you're working with and what those projects are about.
So some of them we probably can't go into detail about, but I would first like to say that there are so many lived experience professionals that help bring the education at Bateman Horne Center to life that they often are the behind the scenes folks that are doing so much for this community, whether they realize it or not, or get the acknowledgement that they deserve.
Hmm.
And then we have others who use their voice and their platform to help us do this, right? And to help us spread this information and channel a lot of the behind the scenes knowledge. And so I just want to take a moment to really acknowledge and appreciate the what they give to us. And then I would say that, we have a lot of partnerships with universities and academic centers. Um, it's where so much of research and learning happens. So we have to go to the core of that,
Yeah.
right? And they have a bigger platform and resource to expand it. And so we've got some of the top universities across the United States, but then also the world. And then we have other groups throughout the world, like ICANN-CME, Emerge Australia. We have a really strong group that we work with in the UK where they help with the medical education and dissemination. Um, and then I would say, Dr. Bateman and Dr. Vernon have done an instrumental amount of work trying to position themselves within the NIH, the CDC, whatnot, different initiatives there to make sure that the education and understanding about ME/CFS are included all the way along, right?
Right.
And that can be very challenging to navigate that and to have a voice at the table. So that work is important. Currently, we have a couple of research endeavors that we're doing with some universities that could be incredibly promising. I'm looking forward to seeing how that evolves. But on the medical education front, we are working to write a paper to the Federation of State Medical Boards, and that's
That
kind
was going to
of
be my
the
next
top.
question.
Yeah,
Yeah.
on the need to elevate the standard of care for those with infection-associated chronic conditions, and then listing ME/CFS, long COVID, yada, and then providing them with the clinical care guide and access to continuing medical education so that we can start to push curriculum into licensing and credentialing boards as well as I'm losing the word.
Exams.
Exams. Thank you.
Yeah,
Yeah.
I'm thinking, when you become a doctor, you have to write some exams before you can actually start practice. And I know in Canada we've talked about it, but have not kind of been able to affect it. Like if ME isn't on those exams, students aren't going to study it and
Right.
teachers aren't going to teach it.
Right. If we can get it on the exams, they have to teach to it. And that's
Yeah.
exactly what we've been doing. And we have a couple amazing experts in the field that are, influencing and allowing us that access to be able to have a voice at that very table. So we're
Wow.
hoping that there will be some change there as well systemically.
That's really exciting. I mean, I know all of each of these things is so much work and, having worked on many, we'll call it advocacy projects, they all take way longer than expected and there's challenges and hurdles, but I get the sense that your ripple is getting bigger.
I hope so. It feels
Yeah.
like we've gotten very, very busy overnight. And I would say though that part of that are just really strong partnerships,
Yeah.
and being able to um, rely on others to help inform because one thing I wanted to remember to say is that we do have patient modules built by patients with lived experience, but are also healthcare professionals who have created these, if you will, learning modules for patients on how to
Okay.
walk them through their disease. So, understanding their PEM experience, how to modify activities in their daily life, that's something that we created with Emerge Australia because we're trying to branch this standard of care, right? And now we're taking the clinical care guide and breaking down chapters to create accredited modules for providers as well. So, um, I don't know if that it
Yeah.
feels a little off topic now, but it kind of reminded me of just the importance of working together because our approaches in our countries might be different. We might have to prescribe differently, but the
Right.
standard of care should be the same for this patient population.
Yeah, that's fantastic. And to know that things are happening, collaborations in different countries is really exciting. I think we saw that with, the whole debacle of graded exercise and CBT. It really took patient advocates in many countries in the world working together, to force the hand and to bring to light the fact that that was headed in the wrong direction.
Exactly.
Yeah. Um, Let me just see here. Are there, I guess my last question is kind of what things and you've already alluded to some of these, what things you're working on or hoping for in the future?
Yes. So what I had just mentioned about the accredited learning modules, breaking down the clinical
Hmm.
care guide, that's a big one that we're working towards. Accreditation's really hard and expensive to get in the United
Yeah.
States.
It
So,
is here too. Yep.
yeah. And the standard of care paper to this Federation of State Medical Boards. Um, we also are working to create this access to care model of Bateman Horne Center, which will allow more um, our ability to bring in more patients and get them
Mhm.
diagnosed with a care plan. But that too, again, will go back to the education side of this. It allows a perfect training ground for
Yeah,
providers to come through, learn, take back, and scale.
that's fabulous. I'm wondering if there's any last messages, I guess, especially for the patients who are listening, um, messages of hope that you want to leave them with.
Yeah, that's hard because it is hard to hold on to hope when you live with this illness. And I think the hardest
Yeah.
part about just that is that there's so much ambiguity around the day to day. And yet, I hope that the patient community and everyone listening knows that there are people fighting on their behalf, that
Hmm.
there are researchers and doctors and other lived experience professionals and advocates that are working tirelessly to bring more access, to bring treatment and relief, that is happening even on the days that it feels like we're not making any progress at all. People are still fighting the fight.
I think that's a great place to end. Thank you so much. This was really enlightening, and you've just shared so many of the resources. And basically, most people could access them through batemanhorncenter.org or through your YouTube channel. Would those be the two big places to look?
Yes, that's where I would look. Also, if you find us on social media,
Mhm.
we have a lot of links that bring you directly to those top resources as well pinned.
Okay. Thank you so much. I really
Thank
appreciate your
you.
time.
Thank you.
Thanks for joining me on the Dr. Eleanor Stein podcast. I hope you are taking away new strategies and ideas to improve your health and a renewed sense of hope. Join me, Dr. Eleanor Stein, for our next episode. Can't wait? Check out my website for a wealth of free resources.